My name is Yew Toh Wong. I'm a vascular surgeon, and my interests are, aortic surgery, carotid surgery, venous problems, and leg swelling. So what I do is essentially, if you like, a medical plumber. So the blood flow in the body that's sort of carried from the heart to the rest of the body to carry the oxygen there. And then the blood from the different regions of the body are carried back to veins to the heart again. So I'm dealing with the arteries and the veins, which are basically pipes that carry blood away from the heart to the different organs and back to the heart through the veins from the different areas of the body. So the conditions that will affect these areas are usually if someone sustained, let's say, a motor vehicle accident or a work accident, and then they happen to damage one of their arteries, or as a result of their work injury, they have to be immobilized for a period, and then they had deep vein thrombosis. Those are the areas that I'm dealing with. I enjoyed the specialty initially because it was a technically challenging specialty, and I initially wanted to do organ transplantation, which requires a lot of vascular skills, but eventually, didn't end up doing organ transplantation, but ended up doing vascular surgery because it deals with many regions of the body, and also there's a lot of new technology that's associated with the specialty that can actually help the patient. In terms of the the specific condition that I see, often my specialty knowledge can provide a good insight into a problem that has not been managed adequately, and just by giving some suggestion, the management institute can actually result in significant improvement of the patient's condition. I like that because even though a lot of the time I'm not necessarily operating on the patient, but by just providing the correct management plan for the patient gets a lot better. I mean, I often see patients with significant leg swelling, and they are very very disabled by it, and then just by telling them that they need to exercise regularly and improve their calf muscle pump function, and just by those conservative measures, the patient often has significant improvement and does not require any further surgical intervention. And I have had quite a few patients who are very grateful for that suggestion. I can help the referrer by providing a clear diagnosis, or even if there is no clear diagnosis, I often can suggest a good management plan that will help manage the patient's problem, and then by managing the problems that the patient has, such as leg swelling, they can actually return to work within a few months, and sometimes they're no longer disabled by it because of the pain. I want the person who's injured who come to see me for an assessment to come away with the impression that I'm actually a friendly person who is there to provide an independent assessment of him or her. And also, I want them to feel that they have been listened to and their concern has been addressed, and and I'm there to help them as best I can to get back to work, and this will lessen their such a psychological burden from not working. My aim is to actually provide an accurate assessment of an injured person so that they can move on with their life, so to speak, so that they can either have certain treatment and then or anticipate when they can actually go back to productive work again and bring an income back to the family, or alternatively they know that they are no longer being able to work in the same field that they used to work, and then they have to make alternative arrangement or think about retraining, and so that they can move on with their life. And I think this is an important area that I can make contribution, as I've been in medical practice or in vascular surgery practice for over 25 years. And I think by participating in this, I can help with increasing the productivity for the society as a whole.